COVID-19, a lot of the public health emergencies and issues we have had. And you've been the author of a lot of scholarly articles, being part of studies, international collaborations, and you're very highly experienced individual, sir. And it's good to have you with us on the program. Um, just to go straight to the point, what is your take and your analysis of the state of healthcare in Nigeria as we look at the World Health Day, sir?
Well, the World Health Day that was just celebrated a couple of days ago has this theme for this year as My Health, My Right, which is the WHO way of saying that health is a fundamental human right to all, like all people all over the world. And if we bring that back to Nigeria, the question we'll ask ourselves is, how many people in Nigeria have access to health, access to quality healthcare, access to health education, and access to health information? If you look at Nigeria, we're still very poor, below bar. So if I have to do an analysis, I would say Nigeria is yet to implement the concept of health being a right for every Nigerian.
All right. Okay. So can you can you give us a picture, paint a picture of what is what should we expect to see in a system where the concept of health being a right for every citizen exists?
In a system where you talk of health being the right of every citizen, you're looking at a situation where the country has proper medical services, that is infrastructure, manpower, equipment, and medicines that would cure the people's problem. And you have a system where these health services provided, be it public or private, is procured and made available to the citizenry. First, the provision of the health facility. If you look at Nigeria, our health system is still very poor. Most of them are not up to date. You have obsolete equipment. Things are not really working. Then if you come to procurement, you don't have a system where the services are procured centrally and then made available to the citizens. If you look at a place like the UK, they have a system where the government procures the health services and makes it available to the people. Even in other US, other countries, you find some kind of system that provides access to people to have healthcare. But ours is still a pockets of it. You find one state doing health insurance, you find another one doing pockets of health insurance. So generally speaking, the provision of the health service is still very poor. Procurement of the health services is still not well articulated. Access to the health service is still very poor, because many Nigerians, or most of us, still have to fall back on paying out of our pocket to acquire health service. And a system where majority of the people have to pay from their pocket, they can hardly afford health services.
Interesting. You've painted a picture, maybe a grim but a true picture of the state of things. You've talked about infrastructure, you've talked about the system, you've talked about paying out of pocket. Sir, do we have anything to be positive about, any positive development as far as the sector is concerned, something that we can beat our chest and say we've done well in this area of healthcare in Nigeria?
Yes, we have everything it takes to be successful. The manpower. I can gladly say that Nigerian doctors trained in Nigeria are all over the world practicing medicine everywhere. The UK and other countries depend on our products. Like we talk of a lot of our young doctors moving on to UK, moving on to Saudi Arabia, people who are trained there. So we have quality trained doctors in Nigeria. It's just a question of those in authority or those in government shifting the policy a bit and being more assertive in implementing what should be done. So we'll have the manpower, we'll have the resources in terms of money if it's appropriately utilized. What it just takes is having the right people to do the right thing, or those who are there doing what they know best to do, doing what they've seen others do that worked. So in general, we'll have the manpower, but not properly utilized. We'll have the resources not properly channeled. We'll have people in authority who should just do the right thing and will be where others are.
You've been in government, so I know you're speaking from experience. So are you saying that it's just a with simple tweaks and approach and fixes and simple measures, we can have a world class health sector in Nigeria? It's not out of reach.
It's not out of reach. Let me give you my example. Doctors who've trained quite a lot. If not for this Japa syndrome, where our doctors are living, our doctors are practicing in the UK, they're practicing in Saudi Arabia, they're practicing all over the world, meaning they're quality doctors. Our nurses are all over the world practicing, meaning they're quality people. So we have quality manpower. In terms of resources, the kind of monies we hear being used for one thing or the other around the country means that the resources are there in terms of oil money, in terms of whatever government generates. All it takes is applying it properly. Put some money into healthcare. Make some decisions and be firm about the decisions you make. States talk about universal health coverage, health insurance. Remove politics out of it and be serious about it. At least you'll start from somewhere. I'll give you an example. There is a facility in Port Harcourt here, Romobiakani Health Center. Shell Nigeria is partnering with our health facility and are providing a kind of health insurance for all members of the community around that facility, their host community, and has extended that service to people around. People pay part of sum of 10,000 naira a year, and they get health service from that facility. And it's working. It's been working because Shell has put their feet down and focused on making it work.
Okay, sir. So I'll come back to you because that example is something I want you to expand on. We want to just take a quick message and I'll be back to you, sir.
All right.
This is an infomercial.
Book your flights on the Access More app and get 20,000 naira for shopping. Valid from March the 27th to April the 10th, 2024. Terms and conditions apply.
Okay, we still have with us the former Director of Public Health, River State Ministry of Health, Dr. Nnanna Onyekwere. Sir, you were saying as we're speaking on the state of the health sector in Nigeria, and that is an example of access to health that a company, a private organization in the oil and gas sector put together, which is working. So please expand on that.
Okay. Romobiakan is a host community for Shell Nigeria. That's where their office is located. And they've been looking at what they could do for the community. The usual thing is pay money as royalty or whatever. And they came up with the idea that rather than pay you this money, why don't you convert it to health insurance payments for you, the members of the community? So the people agreed. So Shell pays the basic premium for members of the community. Then it started with about 7,000 something. Then people from outside who are not members of the community paid about 10,000 for access to that. And Shell put in some resources to make the place functional in terms of equipment, manpower, and set up a proper protocol how the place should run. And the place is running perfectly well.
Wow. All right.
And the idea is so bad that they're beginning to think of expanding it, scaling it up to parts of the state.
Interesting. When we come back from this break, I would like to find out from you, why is the National Health Insurance Scheme not worked? And then we'll take some calls. Please stay with us. Those of you listening, stay with us. We'll be right back.
All right.
Larry, do promise to take this tear rubber SUV with a V8 engine and 0 mileage to be my baby, to drive from this day forward, and full tank and fuel scarcity, to love and cherish and protect it with a Leadway Motor Insurance. If you love your car, show it. Visit auto.leadway.com to get your motor insurance in 2 minutes. Leadway Assurance, ensuring happiness since 1970.
I hope we have received all our vaccinations now.
Yes, Daddy, Mommy, Auntie Peace, and Grandpa finally got their COVID vaccine.
Yes, sir. And you also got your tetanus shot and the HPV vaccine for young girls of your age.
Baba, It's a good thing that you brought everybody to get their different vaccinations and booster dose. Nurse, it must not be here that any member of my family did not take their vaccination, no. And we will keep up with all the schedules. Adult, children, aunties, uncle, grandpa, grandma, all the family members.
I am glad you decided to follow Who Know Road.
Yes, nurse. Now I can sleep better knowing my whole family have been vaccinated and are well protected from all these yama diseases. Now, I dey follow Who Know Road.
Remember, no matter your age group, there is a vaccine for you. Boost your immunity at any age. Visit a health facility to find out which vaccines you need or call 7722 for more information.
Who is there?
It's me, Amaka. What's going on? Why is your face like this?
You remember that purchase order I told you about? I have not been able to deliver due to lack of funds, and I am about to lose the supply contract.
It sounds like you need working capital. Ever heard of Grow?
Grow? No, tell me about it.
Grow specializes in providing quick and flexible financing options for small startups or established businesses in need of working capital to keep their business on track.
Attention business owners, listen up. Are you a contractor, supplier, or distributor? Grow is here to elevate your business operations. So say goodbye to delayed payments. With Grow, cash flow challenges become a thing of the past.
Sign up now at www.growfinance.tech
or call us at 0201 3306 201. Grow, empowering dreams.
Every parent wants to see their child growing up happy and healthy. Introducing Renzo Vitamins for Kids, a secret to your child's daily nutrition and boundless joy. With Renzo Vitamins, your child will have the energy to embrace every moment and unlock their full potential. Give your child a head start in life with Renzo Vitamins for Kids, because a happy child is a healthy child.
Promo, promo, promo! Did you know that you can get a plot of land for as low as 770,000 naira? Bliss Legacy Limited, a registered real estate company, is having 50%, 40% and 30% discount sales for the festive season across all our estates in Lagos from April 1st to April 15, 2024. We have estates in Mowe Ibafo, Ketuepe, and Igbejuleki. Take advantage of this promo and invest in something that beats inflation and will give you a high return of investment. What are you waiting for? Call us today and let's book you for inspection. Call 091 699 84773. 091-699-84773 or visit our office at 54B Adeniyi Jones, Ikeja. Bliss Legacy, changing lives.
Are you a self-employed artisan, accountant, lawyer, mechanic, tailor, market man or woman? Are you worried about the poverty that is associated with old age? Then worry no more. We have good news for you, and it is called the Micro Pension Scheme. The Micro Pension Scheme is part of the Pension 5-year strategic plan to increase the contributory pension scheme to 20 million contributors by 2019 and has 3 key benefits. 1. As a contributor, you would have access to regular stream of retirement income at old age. Plus, you would enjoy various incentives offered by your pension fund administrators. 2. You would be well informed financially, have financial freedom, and your wealth will be transferred to your loved ones in the event of death. 3. The scheme will promote growth and development of capital, mortgage, and insurance market, which will positively affect the national economy. Think micro pension scheme. Think premium pension. Premium pension, your assurance for retirement.
We believe in a world of good. A world where your gain is my gain, your pain my pain. And when things get tough, we never bow. We'll create a world where we think good, act good, feel good, and most importantly, share good. 'Cause what's the use of goodness if not shared? In this world of good, goodness is only a sip away.
Malta Guinness. Enjoy a world of good.
Welcome back to your #1 talk, news, and sports station. This is Nigeria Info.
Nigeria Info.
This is Morning Crossfire on 99.3 Nigeria Info.
Welcome back. It's still Health Thursday right here on Morning Crossfire. Apologies for the earlier, network issues we had earlier. But we thankfully were able to connect with our guest. He's former director of public health in River State, at the River State Ministry of Health. He's a public health and community physician with combined public and private sector experience of over 30 years. He is a former provost at River State College of Health, Science and Technology, currently a lecturer at the Community Medicine Department of the River State University in Port Harcourt. Of course, we're observing World Health Day, which was held 4 days ago on the 7th of April 2024, assessing Nigeria's health sector this morning with our guests and also with you. If you're listening to us, what is your take on the quality of health that you receive? And your overall assessment of Nigeria's health sector, because like you heard from our guests earlier, the theme for World Health Day 2024 is My Health, My Right. My Health, My Right. And according to the World Health Organization, this year's theme was chosen to champion the right of everyone, including you and I, okay? Everyone, everywhere, to have access to quality health services. Everyone, everywhere. It means that the young child in Makoko, the man on Budalo, everywhere, should have access to quality health services, to education and information, as well as safe drinking water, clean air, good nutrition, quality housing, decent working and environmental conditions, and freedom from discrimination. Let's also recall that the WHO says that Nigeria's health outcome indicators are still inappropriately high, despite modest improvements recorded. And the UN Health Agency said, and I quote, Nigeria experiences multiple public health events perennially that are most infectious. Is what they're saying. I want to go back to our guests, but for those of you listening, what is the state of the health sector as far as your access, to quality health is concerned? 0201-465-7190, 0201-465-7190. As a number to call. A WhatsApp for your messages 08095 975805, 08095 and you can send a message to us by commenting on a post on Facebook and X, Central Nigeria Info FM. Dr. Onyekwere, thank you for your time once again. And when you were talking about the issues bedeviling the health sector, you said it's not because we don't have the manpower, the resources. We have all of those. But there's certain issues that are affecting us, making it impossible for us to have, the kind of health sector that Nigeria can have. And you said it's not out of reach to have a world-class health sector. Let's look at, since you talked about access and that Nigerians are still paying out of pocket. We had the NHI, the National Health Insurance Scheme, by the federal government. What happened to that scheme, sir?
Well, if you look at health insurance in the private sector, it's working. I gave you an example of the one in Port Harcourt. And I could give you examples of private industries or private sector people who are utilizing health insurance with their HMOs, and the services are going on well. But the huge problem is that which comes from government. Health insurance or the one that government is. Government is not a businessman. Government doesn't do business the way business is run. There are too much bureaucracies and interferences in government business. And government changes, policies change. So you don't have a continuity in running things in the place. I'll give you an example of my experience with this. When it first came, I was still in service then. It came to River State and they said, we have HMOs to choose from. When we looked through it, we didn't find any HMO who comes from River State. We found that all the HMOs were from other states. And that was the first thing we say, how can we raise this amount of money and all go to HMOs who are not our people? That we must raise HMOs who are from River State before we can utilize. Government now said, okay, let us set up our own HMO system and run it. Of course, it didn't work. You know the story of the last DG there, all the money issues and back and front issue. So the business is that this health insurance business, government should allow the private sector drive it. Give them a level playing ground. Give them a favorable environment and let it be a continuous business, not affected by whims and caprices of who comes into power. Today I'm in office, I like it. The next day somebody comes in, he kicks it out. So that the monies are also not eaten anyhow, or the corruption wouldn't also be an issue. So for this to work, government should partner with the private sector and allow them to drive it. Right now, I hear states like Bayelsa have started their own, River State has started their own. I'm not a prophet of doom, but as usual, it will always go that way. Why the private sector one are running. So government, remove your hand, encourage private people to set up their industries and help them run this system for you.
Interesting. Doc, it looks like and it seems, many Nigerians for years have been deprived of the right to good health. Doc, why does it seem like access to good health in Nigeria is a privilege and not a right?
Yes, that is what it is right now. Those who have the resources can access healthcare at any level. What they can't get in Nigeria, they can fly out and get it. But the majority of us in Nigeria don't have access to healthcare. Just like you and I today, I suddenly have somebody that is sick and I need to raise, you go to the hospital, they say, pay down 100,000 or 50,000 before we commence treatment. Most people don't even have that kind of money in their pocket because of the hardship they're going through today. But if they were part of a health insurance scheme, ordinarily they would have been paying continuously and that wouldn't arise. And then also the health insurance schemes are run by government, often target those in public sector employment. They have no time for those in private employment, the farmer in the village, the fisherman in the village, the artisan on the street. They're hardly covered by this policy. So we need a comprehensive policy that will cover the remotest village, the farmer, the fisherman, the shoemaker, the woman who sells akra in the market. We need a system that covers all of them, not just the one that the public sector, people in public sector employment, and you say are running a health. So we are impoverished because many of us don't even have a living wage currently with the way things are going in Nigeria, do not have reserve to go for health care. So the solution is a robust health insurance scheme, not run by government. Allow the private people to run it, and the coverage is universal. Let the government be the regulator, provide access, give rules and regulations, and ensure that every Nigerian, as much as possible, are covered. For those who cannot afford, government to make provisions for their payment of their premium so that they all benefit from the health insurance scheme.
Okay, so you're saying that for those who don't have paid employment, like I have my HMO, I have my employers, my salary, I can't even pay. But you're saying for the farmer who doesn't have a job, who relies on daily income or what they can get from the farm, for the fisherman in the village, somewhere in Calabari land, you're saying that government should pay for them, that we can have a system that works using the private sector.
Yes.
Okay.
Using the private sector. There are those who call the underprivileged who cannot pay their premium. Government has a responsibility of providing premium for such people to benefit from the health services.
Okay, because we look at the NHS in the UK, where the government just takes care of that bill. You go and you get treated for free. Sir, let's just look at the shortage of health facilities in the country. When we're talking about health as a right, one thing that comes to mind is the fact that if it's a right, the man who lives in a village outside Lagos need not come all the way to the city center to access healthcare. Can we call it a right if in the rural areas they don't have access to health facilities, sir? And then why do we have a shortage in health facilities in our rural areas?
Many factors have contributed to shortage of health facilities in the rural area. First of all, our rural areas are poorly developed. So the health manpower you want to send there are not often too happy to go work there. Even when they go to work there, the security challenges we had over the time, maybe places like in some of the places you have kidnappings and you have people being harassed or kidnapped and all that and being killed. That also puts fear in the minds of the health workers that go to the facilities. These facilities need maintenance. Over the years, there has been poor maintenance of facilities in the rural areas. So, but the other thing is, even the manpower that we have, there is inappropriate distribution of the health manpower. I'll give you an example. Are you with me?
Loud and clear, sir. We can hear you.
Yeah. Take a place like Lagos. You have about 2,561 doctors in Lagos. You have about 2,523 doctors in Abuja. While in Kano, the whole of Kano, only 632. The whole of Kaduna, only 711. Delta State, 554. There is maldistribution of the health personnel, doctors between states. And it's even worse between the rural and urban areas. More of the doctors operating in urban areas because life is much better and easier there. Rural people don't even have so much of health facilities. And the ones that are there are hardly maintained. Maintenance is a problem. You go around, you find roofs are leaking. Some places, the houses are deroofed. The people that live there don't even have where to stay. So they will need to comprehensively look at providing for those in the rural area before we can talk of health being a right for people in Nigeria.
Wow, that's a sad one to hear you as a public health practitioner, physician, and community physician of 30 years. Still saying 2024 we still have hospitals with leaking roofs. It's sad. It's really sad to note. 0201 465 7190, 0201 465 7190. Doc, are you aware of any steps taken by the present administration at the federal level to make healthcare accessible or more accessible to Nigerians, and at least move it forward towards being available to everyone? Are you aware of any of these policies, and what are your thoughts on them?
Well, as usual, a lot of rhetorics and plenty of talks, but little to show for all the talks. Currently, some states are here, like my state, is already started a health insurance scheme. Bayelsa has started one. The federal government is planning to do one thing or the other. Until we see those things yield fruit, it will just be as usual. And then the other thing I told you is that whatever thing you're doing that does not provide for the man and woman in the rural area, that does not provide for the people on the street, that does not provide for the mentally ill, that does not provide for those in prison, you're not doing anything. There has to be a comprehensive package. You gave me an example of the UK National Health Scheme. It covers everybody. Today, even if you're 80 years, 90 years, you're sick, you're provided for. But here, where are we? Even while you work, right now, what happens, they give you what they call health allowance, maybe 7,000 or 8,000 naira as a health allowance for the month. What would that do for you in current day? You hear of people going to hospitals and after being treated, they're seized. That they won't let them go because they're unable to pay their bills. And that is against the fundamental human right. Why would you seize a human being because he's unable to pay his bill? That's where the government, insurance, everybody should come in to see that something happens to the citizen.
All right, interesting. We'll take a call or two before we ask the next set of questions. 99.3. Good morning.
Good morning. Good morning, Mr. Kofi. Good morning, Doctor.
Good morning.
I'm Mr. Jiboli calling from Ikorodu.
Welcome.
So I want to thank you for the discussion you're having this morning. But I also want to ask a question. I want to ask the doctor a question. Quickly, aside manpower, I'm a nurse, and aside manpower, shortage of manpower, I also look at the area of, drugs, accessing drugs, injectables, the whole nine yards, everything we use in carrying out our work in the health facilities. Doctor, what do you think the government can do to subsidize drugs, to subsidize all this equipment that we use? Because these things also aid in shooting up prices of treatment in the health facilities. Thank you, sir.
All right, Mr. Boli, thank you very much for that brilliant question. Doc?
Thank you very much for the question. That was a very good one. I agree with you that we have shortage of drugs and manpower and equipment. If I want to look at it from a very pragmatic way of looking at things, if the health facilities provide services. For you to provide services, it means you must have qualified manpower, functional and up-to-date equipment, drugs that are working. Then I can call you as a service provider. And these people will remain in business if there are people who are procuring their services. That's where the insurance or whoever the system comes in to procure the services that they offer, that guaranteed reward for their services. Then these services are now made available to the people through these insurance schemes. But the problem we are having now is some of the companies, GSK, are leaving because of some harsh economic environment. Some are leaving because they can't get their money out. Some are leaving because the naira, dollar fluctuations and all that. This is where government comes in to look at how they stabilize these things and ensure that even when in the face of this, if there is a policy where insurance companies or whatever buy off the services, procure services, the facilities are ensure that they will get their money every month or every quarter. Then the distribution or utilization is left to the insurance company and the general people. So from what she said, government can subsidize, government can do whatever they can, but for sustainability, we need a system that ensures that whatever is being run in the health facilities is being paid for. Kofi, I can tell you today, some hospitals don't even get patients, not because people are not sick, but people cannot afford it.
That's a stark reality of our time, a really stark reality of our time, really sad. So talking about manpower shortage, very briefly, we know that, medical students are graduated every other year, with a large number of them from all the medical schools across the country. And I want to say, I believe that not all of them are jumping on the brain drain wagon to leave the country. So when we say we have a manpower shortage, is it that we're not training enough medical students, we're not graduating enough doctors, or is it that they are not getting employed?
It is a combination of many. The first one is those who are already trained and experienced are leaving. I read in Vanguard of the Minister of Health saying that 16,000 doctors have already left the country on Japa to other places. And some of these doctors are left are not just young graduates, some are consultants of many years experience. I can personally talk of a consultant anesthetists who is right now in Saudi Arabia. So people are leaving. And like you said, they are training more people. Secondly, the government is also not employing. The private sector is employing and paying them very poorly. The graduate doctor comes here, you pay him 100,000, 80,000, 120,000 a month. He just manages, and every opportunity he gets to leave, he leaves. So we need to talk about a remuneration that will keep the healthcare workers. We need to train more. Okay, look at the policy now. Government is saying that more, since people have left, they should train up more, and asking the medical council to increase the number of slots they give to medical schools, to increase the number of doctors who train out. A fiat. Kofi, the next question is, these training facilities are already congested. Imagine a training school where you have over 100 medical students in one class. You're now asking them to double it to 200 or 240. Are you going to give them money to expand their classrooms? Are you going to give them money to expand their hospitals? Are you going to give them money to employ more teachers? You just say increase the number. We'll end up training and producing half-baked doctors. So if you want to do the right thing, follow it from beginning. You want to train more people, look at the facilities where they are trained, work it from there, not just a fiat that says increase the number, and then the people start struggling to increase the number. Pay them well. If you pay them well, create a better working environment, people will not leave. Even the Nigerians have left to the UK. Some are complaining. The services are not that suffering because the kind of work they do to survive is not the best. They would have wanted to come back home. So create a good environment for them to work at home here. Encourage them to do the service they do. Encourage those private sectors to open their clinics and do more things. Encourage the public health facilities to do more.
Right.
Everybody will be.
All right. Interesting. We need to expand this conversation to look at the issues one by one. But we want to leave it at that and to say a big thank you to you, Dr. Nnanna Onyekwere, former Director of Public Health and River State Minister of Health. Sir, thank you so very kindly for your time this morning.
You're welcome.
Thank you very much.
Anytime.
Thank you very much. All right. We will expand the conversation some more in the coming weeks, but we take a break right now.
This is an infomercial.
Have you ever dreamed of creating videos that captivate and inspire? Are you in search of that perfect space where your visual ideas can flourish? Or perhaps you're on the lookout for a venue that will add a touch of magic to your events? Look no further. At We Entertainment Production Limited, we're not just a media production company, we're your gateway to bringing visions to life. Nestled in the heart of Lekki, Lagos, we offer an oasis for creators like you. Whether it's TV or film production, event coverage that captures every memorable moment, commercials that resonate, breathtaking music videos, the artistry of photography, or content that engages. We have it all. Plus, with our state-of-the-art studio rentals, you're equipped with professional-grade gear from the get-go. At We Entertainment Production Limited, we believe in doing beautiful things. This is our promise to you. Get in touch today. Call us at 0908-826-5049, 0908-826-5049, or email info@web.ng. That is, in capital letters, info@wep.ng. We Entertainment Production Limited, where beautiful things happen.
All right. We know the issues. Our guest has been able to paint the picture of our current state of healthcare in Nigeria. We didn't even touch on every single aspect of what needs to be done, but he was able to highlight a few. But it is hoped that the coming of the Bola Tinubu administration will herald a new direction, a new focus, a breath of life to healthcare in Nigeria. We want to take a break, and when I come back, I'll say my goodbye. Also, we'll do the one play draw on the other side of the hour. Stay with us. We'll be right back.
99.3 Nigeria Info. We'll be right back.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info.